So, as a women's health coach and menopause and workplace specialist, I was able to contribute to the standard in a wider perspective, bringing my clinical experience into the conversation. So, whilst we were talking around menstruation and menstrual health and also the menopause journey, actually, when we look at some of the symptoms that women struggle with in the workplace and their experience of being in work with these symptoms, where in my clinical experience, we could then really connect it back to what women are saying that affects them in the workplace and some of the things that they don't understand as well. For example, fatigue. Somebody who has fatigue might have endometriosis, also might have the perimenopause or menopause. But then there are other symptoms and health conditions that are mentioned in the standard, such as chronic fatigue, fibromyalgia, and long COVID, and also, thyroid issues. And with that, all of those illnesses and conditions, generally, they also struggle with brain fatigue as well. So, due to my experience as a women's health coach and working with women in a clinical setting, I was able to put that input into the standard. So the standard will improve the well-being and health of those who menstruate and also those in menopause if it's applied well. And that is really related to the senior leaders within the organisation to really buy into the standard and the cultural change that they want within their organisation and the value that these people bring to the company if they feel supported and have the right support and recommendations within the organisation for them to continue to be a valued member of that company and thrive. There are many steps an employer can take to implement the standard to make change in the workplace that is positive for everybody. And with the standard, they can really make some huge changes within the organisation. This is a really exciting time. So to make maximum change, they could use their standard to do that. And the practical tips, such as, maybe having a podcast or a blog or some leaflets around the organisation, or maybe it's some in-house training to raise awareness for the whole organisation so that it's not just that you have this standard, but you also are educating everybody within the organisations. And I think sometimes leaders, senior leaders and managers and HR also need some training around this as well, so that they can have like a really authentic conversation around menstruation and menopause in the workplace. So with the standard, it'd be great to do some sort of launch, bringing everybody involved with the organisation so it becomes something that actually makes a difference. And then keeping the conversation going as well is really important. So the challenges that individuals face at work, I think, are one, the symptom that they struggle with, whether it be just having a menstruation cycle, the changes of that, or they have other conditions like PCOS, PMDD, PCOS, fibroids, or other conditions like an autoimmunity, for example. And then perimenopause and menopause. But then it's about what's the experience like in the workplace? How does having those conditions or symptoms impact work? And, do they need to take time off, for example, to make hospital appointments? Or do they need to take time off because, they are having heavy bleeds or heavy flows? And so the standard actually helps lay out a comprehensive understanding of the symptoms that I've just talked about and conditions, but also how an organisation can actually make accommodations for those people. And it could be something as simple as that they have somewhere to store change of clothing or free sanitary wear or, sanitary wear in the bathroom, in the toilets for these people to use. So employers can actually make such a big change in the organisation to improve the workplace for people who menstruate and also in that menopause journey as well. And the standard really outlines all of those things that they can do. There's a toolkit for HR and line managers to use. And, if a company really embeds these things within the organization in their own way, and it really depends on that particular organization, the profession that the person is, the roles that they do, the industry that they work in, and also the size of the company as well. And currently, we're all working towards what is best practice, and we don't really know what it is. It really depends on all those things. However, the standard gives some really good advice and tools for this to be in practice.